Welcome back. This is Dr. Sharawi. Again, today's lecture will be talking about the kidneys in brief. Now, we have two different kidneys, and those both kidneys are retroperitoneal organs. That indicates that they are all the way in the back, within the behind the peritoneum itself. Now, if you look at the right of the left kidney, that there is a level elevation within the left kidney. The left kidney is higher than the right kidney, as we see here. So the left kidney is higher than the right kidney. Then we have an adrenal glands or supraadrenal glands. Okay, now we have an inflow of right renal artery, left renal artery coming off from the abdominal aorta, and definitely venous drainage from the right kidney is called the right renal vein, and the left renal vein opening up directly into the, or draining into the inferior vena cava. Now we have a region. A region is an area. It's not a particular point. It's a region, and we will call or refer to it as the renal hilum. Now, the renal hilum is basically the inflow and outflow of different structures. So initially, the inflow and outflow of the blood vessels is called the first the renal artery, renal vein, and definitely whenever we have vessels or arteries and veins, we would have the drainage portion, which is the vascular or the lymphatic system. Okay, so it is not shown here, but just to let you know. Then we have different nerves, and we have the renal pelvis right there, which will be carrying the filtered urine outside the kidneys through the renal pelvis into the ureters. Now we have a right and a left ureters that eventually would open up within the posterior or the posterior inferior portions of the urinary bladder, and eventually into different pathways, and it's passing through the prostatic gland. So this is definitely a male, and that's where the prostatic urethra will take place, and it will open up eventually outside into the urethra or the penile urethra. Okay, so this is a male organ because of the prostatic gland. Now let's go ahead and take a different section or different views. Now we find that we have different pyramids within the kidneys itself. This is just a cut section here. So this is a normal covered anterior